what should we look for if someone's had an unwitnessed fall?
Truthfully, you should start by talking to them. You know them best than anybody else, and you'll know what they're like normally. So the first thing is talk to them and see if they're behaving normally for them, and listen to them. Even if somebody's really confused, they may well tell you that a bit hurts, or just by talking to them, you'll see that behaviour is not normal. So that'll give you a clue that there's something more wrong than just the fall. If you see any obvious bumps or bruises, then you can note those. And then after you've spoken to them, ask them if they've got any pain. It's about having a feel from top to toe. So there's nothing particularly clever about looking after people with falls. It's all the stuff that you will have done with a child that falls over or anybody else. So can you see a big gash on their head? And maybe run your fingers around the back to see if you can feel anything in the bits that you can't see. Have a feel down their neck and ask them if they hurt. And the touching and the feeling is really important, particularly for the people that can't explain stuff to you. So if you press on a sore bit, you'll get a reaction, same as you would do with a little child that's pre-verbal and can't talk to you. I would then have a feel down their chest. Just press on all of their chest and see if it hurts. And the same with pelvis, and then feel down the long bones. It's all the bony bits you really want to feel, and have a look and see if they're all looking like they should do. So rolling
in
bits
the right
up.
place.
Yes, exactly. Big breaks are really obvious, and we're not worried about little really subtle things. Pelvises, you can't see breaks, but that's why it's important to have a good feel and maybe just a bit of a wiggle. If somebody's telling you none of the bits hurt, then you're probably in a good place to know that actually they haven't done any severe damage. Once you've had a good feel, you can try getting them to move bits. So that might be you giving the pelvis a bit of a wiggle, or the legs a bit of a wiggle, or the arms a bit of a wiggle. It's all about wiggling. And if that's all fine without any pain, then you can start thinking about getting people up off the floor. If at any point somebody says this really hurts or you're worried, then you can always stop. So you don't keep going through something that's caused them more distress. But there's nothing really clever about it. You know this stuff. Anything you'd add to that?
No, I think that's absolutely right. Logical, things that seem safe and seem logical that you're comfortable to do. Brilliant.
So what about if they're normally confused?
You are the experts. You know them, so you know what's normal for them. And we're looking for anything outside the normal. And everybody's a different person, whether they're confused or not. So you will have some residents that aren't confused, but are always very melodramatic and everything's a disaster. So you play that down. And in the same way, if somebody is cognitively impaired or confused normally, getting an idea of whether they can do the things they normally do gives you a really good idea as to whether everything's all right or not. Whether that's recognising the person in their favourite photo or being enthusiastic about their favourite pudding, it might be something that's totally off the actual situation. But if you know they're behaving like normal, and that's stuff I can't teach you. You guys know these guys.
But sometimes bruise doesn't come straight away. It comes maybe after 24 hours, or it doesn't say anything. Like they're fine. Like we have resident who has she didn't have bruise there when she fell over. So she didn't have any pain, but the next day it appears. It was quite big bruise.
So that's really reassuring if they haven't got pain immediately. So broken bones, it absolutely snaps there and then, and they're going to complain of a lot of pain at that point. Bruises, sprains, things like that, they get more and more sore as the swelling comes out. So in some ways, it's really reassuring if they don't have pain until the next day. And you're absolutely right. Bruises take a while to come out because that's blood under the skin. So if the bleeding's happened deep under the skin, it takes a while to get to the surface. And if people have pain the day after, then you're absolutely fine and probably right to maybe get the GP to check when they come out and stuff like that. But if it's taken that long, I wouldn't be too worried about it. Fast things happen fast, and they're the real emergencies. Does that make sense?
Yes.
So when we ring the ambulance, what information do we need to tell you?
So the call takers go through a triage process. So the questions they would ask for every patient. So the first questions will be to rule out any life-threatening situations. After that, once we've established that there are no threats to life, they will ask questions such as how far they fell, whether they have any immediate injuries that you can see, how long they've been on the floor for. And that's pretty much as far as the triage process goes. They're not clinicians, so they can't go into a big triage with you on what you should be doing with that patient. It's just to establish, is there any threat to life? What is it we need to be doing now? So do we need to come and pick this person up? And that's as far as it goes with the triage.
So apart from injury, do we first about the care plan, or the detail about the patient, or when they arrive, we have to let them know about any, they have allergies with the penicillin or anything?
So, normally they wouldn't ask those questions. We might have that information already. Right. If it is a care home that's given us that information already, but those questions aren't really relevant at that triage process. So it will be something that you'll need to provide the ambulance crew when they arrive.
Okay.
We've developed a sheet of all the information that we really want when somebody comes to hospital, and having that sheet ready is really useful for the paramedics, and hopefully that also gets to hospital. Yeah. It does normally. And then we lose the stuff when they get there. Yeah. So having the original respect form ready to go is really important, and we always want the original, and I will acknowledge that sometimes hospital lose them, so I understand people not wanting to let them go. Please keep a copy yourself, but the original should come into hospital with the patient. Think of it like their passport. So they wouldn't go on holiday without the original passport. They shouldn't be going into a healthcare setting without the original respect form. And there's a couple of reasons for that. The main one is that actually if somebody's needed to go to hospital, particularly in people that are living in care homes, the chances are that that visit to hospital is a significant enough event that ideally we should be updating that respect form, and things will probably change on it. So if you've kept the original, you're probably then keeping an out-of-date one. Okay? Yeah. I would encourage you, if you don't get original respect forms back again, to let the hospital know, because people should be sending it home, but unless we start pointing out when they don't do it, then people don't learn. So please let us know, and if you don't get a discharge letter back and things like that, let us know, and we are trying, from the hospital point of view, we're trying very hard to educate everybody that they need to send all the documents back home, including the stuff that you sent with us. And you may have seen the This Is Me folders, which are bright orange folders. Have you had any of those?
No, I have not seen either.
So they're really distinctive folders. They're sort of shiny cardboard, orangey coloured, and we try and keep all the paperwork together in those now in hospitals. So you should get them back with the respect form, the original, and a discharge letter, and maybe a couple of other things in there. It's not for lots of information leaflets. It's for very personalised care and things that you need to know about that individual. So hopefully you'll get clearer communication back again. The form is quite self-explanatory for the information that we want off you, but there's two things. One, and I think you guys will agree with this, having somebody that really knows the patient or who saw what happened or both, is absolutely priceless. It never comes through on the paperwork. And from my point of view, having a phone number that I can actually get hold of people on is really important. We often get given the sort of managerial number that won't get answered out of hours. So having one that's answered at 11 o'clock at night is really important. And if there's a carer that's a witness that has seen what happens, if we can get their personal mobile phone number and a time that they're happy to be called up until, that's really, really useful, because I don't expect you to stay and work until I get round to calling you. But having that contact number of a real person that really knows what happens totally changes what I do at the hospital.
And I would also add that if you know that individual patient well, you are the expert, without a doubt. And for all of us, this goes on from what you were saying, regardless of the clinical issue, like what the actual injury is, if you know what that person's normal activity level is, their normal way of thinking, their normal interests, you are vital to the process. And often when we will arrive, we will encounter maybe the manager of the care home, but they may not actually know the patient very well, but they'll be the one who often stands with us while we assess. Yeah. In actual fact, regardless of what your rank within the structure is, your knowing that patient it puts you ahead of everybody else. And to any paramedic arriving on scene, you're the first person we want to talk to, because we want to know if your patient is normally like this, or if there's something that you think is very much out of character.
Yeah, sure.
So it's really important to us.
I had a lovely phone call last week of a fairly junior carer who'd come to work and found out that one of the residents had gone in, and they rang me to tell me certain things about them, which totally changed what I did as a doctor.
Oh, yeah.
Totally.
Yeah, wow.
Because they knew what that person's priorities were, what they were really scared of happening, what they'd always said they didn't want to happen. And actually, that whole phone call was about that. For that patient, dying in the familiar surroundings was the most important thing, and we managed to get rapid response involved and emergency transport, and we got that person home to die in a familiar surrounding. And without that carer ringing and saying, I think they might be dying and they really wanted to die at home, we wouldn't have, the doctors were all going down the highly medical route. But actually, by hearing that bit of a story, we did the right thing for that patient and provided individual care. And listening to the family be so happy about that, but the family hadn't felt able to articulate that, whereas the carers told us. That's the other thing that's really useful, particularly if somebody is normally confused. I understand you guys have got a whole care home to be dealing with, so I know you can't come up with the patient always. If you know somebody who's going to struggle while they're in hospital and might have some challenging behaviour, having somebody they know come with them is really worthwhile. And even if you guys can't come, if you ring the next of kin and say, please meet them at the hospital, I'd go as far as saying you can tell them to meet them at the hospital, don't ask them. But that's the most important thing for that patient or the resident, having someone they know. I mean,
reassuring for
I'm scared going into A&E, and I go there every day. But I know these guys have a wobble sometimes going in there. So if you've never been there, it's even more scary. And we know now that if you've got dementia, it's about 90 times more scary being in A&E. It's really a horrible place. So having somebody that you know there and that can explain things is really, really important to get the right care for people. Is there anything else you want to ask? I'd love to know what the things that really annoy you about us are. We'll answer these or explain why we do them, or learn from your feedback as to what we need to stop doing.
So we've already answered the questions on the phone to the paramedics. When they then come, why do we have to answer them again?
Do you want to go with that, Louise?
Well, so the person that takes the call, they're not a clinician, as I said earlier. So they're just triage questions. They're not trying to figure out what's wrong with that patient. Also, when the paramedics turn up, it could be hours later and the situation may be completely different, may have changed. Also, when the paramedic turns up, it's going to be their patient. They're going to want first-hand information about what they're dealing with, and taking information from something that happened 3 hours ago is not...
It's totally different.
Yeah, so they need to start the process again and find out exactly what happened, so they have it in their heads. They understand what the situation is, and then they can deal with it appropriately. So I know it can be frustrating to answer the questions again, but it's just so that we make sure we give the patient the best care.
And what you tend to find is that most paramedics, from the very new ones right to the really experienced ones, have an order that they'll ask their questions in. And it may differ from person to person, but they'll have a structure in their head. And because of how the information that you give on the phone is passed to us in the ambulance, we have a small computer screen. It doesn't usually come through in full. We may get part of it, sometimes we get none, and sometimes we get a lot of information, but it still may not be directly relevant. So as part of that clinician, that paramedic looking at that patient, they'll always want to hear firsthand the information they need. And also, because they're going to then take potential responsibility for that patient, they want to be doubly sure of every bit of information that they've got. So they may already know that the patient is on a particular medication, but they'll probably still ask it again. And usually what you'll find is throughout the whole process, so if we take arriving on scene, taking a handover and a bit of a discussion from yourselves, then if that patient is taken to hospital or if they're being passed to another clinician somewhere else in the service, they will still go through a lot of that information repeated again. So usually for a patient taken to hospital, you will do your initial phone call with that information. Then when the paramedic arrives, you'll say the same information again. That paramedic will then say that same information to an ED coordinator, a nurse in ED, in the emergency department. And then that information will be relayed on up through the clinicians within that department. So there's an awful lot of repetition. But it's really important because what often can happen is a piece of information drops out and is not mentioned further on. Or sometimes someone within that chain of people who's been given that information may ask a little question that hasn't been asked before, and you'll get an answer to that. So a lot of information needs to be moved, so that's why. But it's frustrating, I do understand.
And there's nothing that replaces hearing it firsthand. And that's why that phone number to a witness is really important. And I know I will ask different questions to what my junior doctors ask, my triage nurse asks, what these guys asked. And there's a real risk with Chinese whispers as well. But hearing the very specific words you choose to use can actually change the interpretation. So we always want to hear it firsthand if we can. But I do understand it is so frustrating, and you feel like it's such a waste of time, but it really changes what we do, and it does change the outcome. So don't think of it as wasted time. It's not that we can't just talk to each other. Most of the time we've spoken to each other. It's just we still want to hear it firsthand. I think the other thing is, if you can send anything that's going to comfort people, please do, but be aware that sometimes things get lost. So if there is something that really matters to the person and will really make them calmer, please send it in if you think you can, but also really, really highlight how important it is. Because, and write the name on it, if you can. But if we know that this is the thing that calms people down, we do try and take better care of it. And also these things that are important for life, so teeth, hearing aids, glasses, please, 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 please send them in, but please in any sort of labelled container that you can do. I don't know if you have the red bags here.
Yes, we do.
But the more, if you can put it in a pot, even if it's your leftover takeaway pot with their name all over it, these things help. And we do try really hard not to lose them. But you can imagine if you're in a scary environment and then you can't see or hear or eat properly, it all just becomes worse. And with all these things, the important things, I understand not wanting to send them to hospital because they're at risk, but they're also the really important things to have. So please, yes. Or any other things, you know, if it's the picture of their spouse. I've had many patients that don't care what I do to them as long as they can see the photograph of their wedding or what have you. So preferably named, labelled, and ideally replaceable, but just tell us if they're precious things and make it really clear what you've sent up. And I apologise in advance if anything gets lost.
Make sure you tell the paramedic crew all these things so that we can then hand it over to the hospital. So
stand over them and go, write down that that's important.
Teddy bears in particular.
Yeah, especially I was about to say that soft toys, they are already cat. One lady has cat and she can't sleep without cat. So important. So it's her agitation with the dementia. It gets increased more and more if she doesn't see her soft toy next to her holding.
And that's like what you were saying earlier. Without knowing that, you know, if we didn't have your knowledge to tell us that, we wouldn't know. So we could take that cat off of her, and then she becomes really distressed.
And
you don't know why.
Yeah, exactly.
It's also worth having photographs of any of these important things.
Right.
So you guys can take photos of it. But if in the worst case scenario we lose it, if we can then produce a photo so we know what we're looking for,
Yes.
that can make a massive difference. So tell us it's important. Keep photographic records of important stuff, and we'll really try and look after it. But the truth is, if we know it's going to help the resident or the patient, then we're much more likely to realise if we know it's important,
Yes.
it'll stay with them and we'll look after it better.
Better.
The bottom line is you are the experts and you can totally change it. And I think I used to be a carer,
Right.
and I think you don't realise how utterly central and important you are